The Social Security website keeps crashing, and it's preventing a lot of seniors from being able to access their Social Security benefits online. At the same time, in a few days, on April the 14th, the Social Security Administration is going to move a lot of services that previously you could do over the phone. They are moving it all online, which is going to create a huge disruption on how you access your benefits. So, what exactly is going on? Well, I'm here to unpack it all. Let's get started. So, a little bit about me. I am Kwame Kwade. I'm an entrepreneur and a personal finance expert. For 15 years now, we've been creating content to help seniors get the retirement benefits they deserve. We started with websites on Social Security, food stamps, Medicare, Medicaid, and more. And now we've been creating video content to bring you the latest news about your benefits. I am also an adjunct professor. I teach entrepreneurial finance to graduate students at one of the most prestigious universities in the United States. So if you're new here, I want you to hit the like button, the subscribe button, because we appreciate your support. And as always, I want you to go into the comments and let us know where you are watching this broadcast from. Give me your city and your state. So let's jump into what is happening with the Social Security Administration and why is the website crashing sometimes multiple times a day. Well, it all starts with this article from the Washington Post. Social Security website keeps crashing as Doge demands cuts to IT staff. The worsening problem comes as Elon Musk's Doge team pushes for more cuts at the agency, including in the department that oversees the website. Now, you would ask, why would they do that? Well, that's what's happening. So, here is the latest. Social Security's online system has experienced multiple outages in recent weeks, with some lasting from 20 minutes to nearly a full day. These issues are preventing many retirees and people with disabilities from accessing their accounts or information. Even when the website is functioning, many users report being unable to log in, finding missing information, or experiencing extremely low report response times. These problems require multiple attempts to complete basic tasks online. Now, this is becoming a growing problem. The issues are occurring as the administration pushes for more services online while simultaneously reducing staff. Many beneficiaries are trying to access the site to verify their benefits are secure, which is further overwhelming the system. Some supplemental security income recipients recently saw an alarming false message stating that they were not currently receiving benefits, causing widespread panic. While these were system errors, the payments were still processed. They created significant stress for vulnerable recipients. So, what is causing all of these issues? Well, the Doge team is making significant cuts at the Social Security Administration. The new administration's cost cutting team, led by Elon Musk, has already cut 7,000 jobs at the Social Security Administration and is planning additional layoffs. These cuts generally or directly affect the agency that serves 73 million people. Now, there's also cuts to the technology division. The team plans to cut 50% of the technology division staff responsible for the website and electronic access. So at the same time that they are pushing a lot of people to go online to verify their identity, they're cutting the staff that works on the online system. So you can understand how this crisis is happening. At least 800 of the 3,000 employees who manage Social Security databases face potential layoffs. And then there are new security measures. Many network outages appear to be caused by an expanded fraud checking system implemented without proper testing. The technology staff did not adequately test this new software to ensure the service could handle high volumes of users. And then there's increased internet traffic because services that could be done over the phone have been moved online. The system is being overwhelmed by a surge of visitors as beneficiaries worried about potential benefit changes try to download benefit statements and file claims. One senior official described it as a sheer massive volume of freaked out people, rightly so, because of everything that's happening. So who is affected? Well, there are a couple of categories of people: SSI recipient, retirees, people with disability, and of course, Social Security staff. So let's dive into that. The 7.4 million adults and children receiving supplemental security income were particularly impacted when the system showed false messages about payments being discontinued. Then there are retirees. Older Americans trying to manage their retirement benefits have encountered significant barriers when trying to access their accounts, update information, or check payment status. Many have been unable to complete simple tasks like updating emergency contacts. And then there are people with disabilities that have been impacted. Individuals with disabilities and their caregivers have faced additional stress when unable to verify benefit status or make necessary account changes. Parents of disabled children have reported sleepless nights over payment uncertainties. And then there are the Social Security staff that have been impacted by all these changes. Social Security employees are struggling to serve the public as the systems they rely on crash repeatedly. Staff have been forced to use paper methods, manually recording information and entering it into the computers when the systems are back online. And there are real life consequences to these issues. In California, 72-year-old Kathy tried for a week to schedule a required appointment through the Social Security website. Despite multiple attempts, the website wouldn't allow her to book a visit, forcing her to endure long wait times. And then there's Robert, a retired financial analyst with a wife that has dementia, spent 5 days trying to update his emergency contact information. He tried different devices, browsers, different times of the day, but continued to receive error messages. And then there is Chris and Tom, parents of a son with profound autism, logged into Social Security's website and saw an alarming message that their son was not actively receiving benefits. Though the payment was eventually processed, they spent sleepless nights worrying about reapplying for his benefits. And then you have field offices that are frustrated because they cannot serve the public with the resources that they need to do that. When the online system crashed, employees at one Indiana office were forced to write down client information by hand. In some offices, managers or security guards had to distribute paper number slips to waiting clients after the scheduling system failed. Now, there are financial and service implications to everything that's happening. Benefit verification challenges. Many recipients were unable to verify their benefits are being processed correctly, causing anxiety about potential missed payment. Though President Trump has stated his administration would not reduce Social Security benefits, many recipients remain concerned. And then there's customer service. As the workforce shrinks at the Social Security Administration, there have been cascading blows to customer service, affecting websites, phone systems, and field office operations. With fewer staff available, beneficiaries face longer wait times and more difficulty resolving issues that they are experiencing. And then when systems crash, employees must record information manually and later enter into the system, creating more work for an already stretched and reduced staff. And then there's transaction delays. Simple transactions like updating contact information or checking payment history have become a multi-day ordeal for many beneficiaries. These delays can have serious consequences, especially for vulnerable individuals who rely on timely benefits. Remember, 60% of people receiving Social Security benefits have other income, but the other 40% rely on Social Security as their main source of income. So that's millions and millions of people that have to worry during these uncertain times with the Social Security Administration. Now, there are some important dates that you need to remember about changes that are coming. I'm going to talk about that in detail in a few slides forward. April the 14th, that's when the new ID verification information or rules are going to go into effect. That's a few days away. The acting commissioner and Doge team are continuing to reduce Social Security staff, so there's more layoffs on the way. So expect more delay. And then they're cutting 50% of the technology staff that work on the website. So don't be surprised if the Social Security website continues to malfunction because the people that work on it, a lot of them are being laid off. And then immediate system issues, current system outages are occurring multiple times a week. This was never the case until recently, with 3 crashes reported on a 10-day period. Officials describe it as brief disruptors averaging 20 minutes, but some outages are lasting several hours. So here are some practical steps you can take if you are worried about everything that's happening with the Social Security Administration. The first is to plan ahead, allow extra time when you need to conduct business with the Social Security Administration. What might have taken minutes before can now take multiple attempts over several days. So don't wait until the last minute to address important issues with the Social Security Administration. And then verify payment through multiple means. If you see some concerning messages online, maybe check your bank account first to make sure that the money has been deposited in your account, because the online system may be giving you wrong information, even though your payments may arrive on time. And then when you call the Social Security Administration, make sure you're documenting who you're talking to. Keep proper documentation, because if there is some responsibility that you have and you're trying to reach them to take care of that responsibility and you still cannot reach anybody, it's still your responsibility. So document the times you've been talking to them, who you talk to, or the attempts you have made to get in touch with them, so that when they come back and try to take your money or restrict your money, you have all the documentation on the good faith effort that you have made to reach out to them. And then while phone lines are also experiencing high volumes, you may need to visit a field office, which you have to make an appointment over the phone. So it's all a loop, because you need to call to make an appointment to visit an office. You can't just walk in. But then the phone line, excuse me, the phone lines are jammed. And then you need to go online to get around having to stay on the phone to do certain services online. But those services are also frustrating because the website keeps crashing. So it's like nothing gives. And so you may have to try several ways to get access to the Social Security Administration. If you call and you cannot get help, then go online. You may be able to do that, or call and schedule an appointment and go in person to get it taken care of. Now, there are resources that can help you. Local offices remain open, though they may be understaffed. For urgent matters that cannot be resolved online, an in-person visit may be necessary. As I mentioned, there's phone support you can call, but then there are advocacy groups that can help you if you are struggling to get in touch or get your issues addressed with the Social Security Administration. And there are a lot of online communities like ours that can help you answer some questions. So if you are facing some challenges, go in the comments. There may be somebody else that's facing the same challenge that may be able to tell you how they were able to deal with the Social Security Administration that can help you get the help that you need. Now, all of this is leading up to April the 14th, where there are going to be major changes that is going to affect everybody and how you deal with the Social Security Administration. So let's talk about that. So the Social Security Administration is implementing major changes that is going to affect you, and they are critical for beneficiaries to understand and future beneficiaries to also prepare. The new in-person identity verification rule will take effect on April the 14th instead of March the 31st. That was the first schedule. It's been pushed back, but it's still happening. And it's going to affect you and how you access services, because you have to verify your identity online. And if you cannot do that, you have to go in person. So who is exempt from this? Well, people who are on Medicare, disability, SSI applicants are exempt from the in-person verification, but everybody else has to comply. Why does it matter? Because these changes, while they are aimed to reduce fraud, can also create challenges for seniors. So what is happening? The first thing is that retirement and survival benefit applicants must verify their identity in person if they are unable to do so online. This requirement aims to reduce fraudulent claims but could place a burden on those without internet access or those having difficulty traveling. And then another policy change is the overpayment issue. If you have an overpayment situation with the Social Security Administration, pay attention to this, because starting March the 27th, they're going to withhold 100% of benefits to recover overpayments for new cases. This change in policy significantly increases the financial impact. So if you get an overpayment letter starting March the 27th, your Social Security benefits will be put on hold, and they will use the money to pay for your overpayment until it's paid off. It doesn't matter how long it takes, months, years, they're going to keep your payment until that is done. So, who is affected by these changes? Well, those applying for benefits, Social Security, and those who have overpayment issues, those who are on SSI benefits. SSI recipients undergoing redetermination may get a lot more scrutiny. So if you're on SSI and you have to verify that you're still disabled and they are demanding records from you, that audit is going to be more frequent than you're usually used to, because there is this belief among the Doge team that a lot of people on SSI or even SSDI do not deserve their benefits because they are not really disabled. So expect more scrutiny to Social Security disability beneficiaries. And then seniors without access to Social Security's online system will now have to go in person, because services that you used to be able to do over the phone are now being moved online, even though we've talked about the online system is not ready to handle all that volume, while they also continue to cut the workers that work on the online system and services. Now, who is not affected by these new rules? People who are on Medicare, SSDI, SSI applicants are exempt from the ID verification rules. And when it comes to overpayments, if you're already on an overpayment plan, then you are not impacted by the new rules. Survivor beneficiaries may also be exempted from the ID verification. That is being considered. So it is not policy yet, but that's something they are trying to implement to make sure that people who are applying for survivor benefits are not unnecessarily burdened with these new rules. And then here are the people that do not have to take any action. If you're currently receiving Social Security benefits and everything is good, you don't need to change any address or any personal information. You don't need to change your direct deposit information. Then these new rules do not affect you. Now, if you're currently on Social Security benefits and you want to avoid having to deal with all this mess, having to go into the Social Security office or having to call and deal with customer service online, here are things you can do now before April the 14th to get ahead of everything. The first one is, starting April 14th, current beneficiaries who cannot use their online Social Security account have to do direct deposit in person. So that is something that you can avoid by getting ahead of it now. Existing recipients who need to verify their identity for whatever reason, if you cannot do it online, then you have to do it in person. So if you want to get ahead of it, then create a Social Security account now and verify your identity through login.me or id.me, and then access your benefits online. That way you avoid having to call, schedule an appointment, and go in person. And then update your information online. Make sure your address, your phone number, your email, everything is current, so that you don't have to deal with having to verify your identity online to access benefits if everything looks good. And then you may want to choose getting notices online rather than through the mail, because usually when you're getting something through the mail, they're asking you to come to the office. And so it's better to get your notices online so that you can stay ahead and know what's happening and receive these online notices so that you can get ahead of things faster and not have to join the large number of people that are going to be forced to have to go to the Social Security offices to deal with anything that they have to do. So before April the 14th, create your Social Security account, verify your information, update your direct deposit information, and if you have to go to the Social Security office for whatever reason, schedule an appointment now, because after April the 14th, there's going to be a mad dash, because people are going to wake up realizing that things that they could do online easily, or things that they could do over the phone easily, now have now been pushed to in person. All the while, they are closing Social Security offices and laying off staff. So the point is that you have to be patient. Things are going to take longer than you're used to. And so you want to get ahead of it now. Now, let's talk a little bit about overpayments, because this is a big policy change. It used to be that if you have Social Security overpayment, they only take 10% of the money from your paycheck, from your Social Security check, in order to pay the Social Security Administration the money that you owe. Now, if you're on SSDI or Social Security retirement benefits and you owe overpayment, they're going to take 100% of your check. The only people that are exempt are SSI beneficiaries, who are still going to be under the 10% policy. This is all supposed to raise about $7 billion over a decade. That is a drop in the bucket when it comes to how much the Social Security Administration needs to address the shortfall in the Social Security Trust Fund. So when they say that they're doing this to help save the trust fund, it is really not that big of a dent that they're going to make with $7 billion when we're talking about trillions in deficits. And then if you are on disability benefits, your redeterminations are going to be more frequent. And so you want to make sure that you have everything in order, that you have your medical documentation, and if you are working while on Social Security disability, make sure that you are paying attention to the substantial gainful activity limits, because if you go over those limits, that is going to cause more scrutiny to your benefits and may get you kicked off disability or your benefits reduced. So the key takeaways here is that new ID verifications are going into effect on April the 14th. Monitor your payments closely. If you realize that your Social Security account or your Social Security benefits have not come in, it may be due to overpayments. So you need to reach out to them and find out. Stay up to date on all Social Security notices and respond to them as soon as possible, because an already stressed Social Security agency is under further stress and further pressure with staff cuts, closures. And so if you need to deal with them, you want to respond quickly, because things that take days may take weeks, weeks may take months. And so you want to stay ahead of it so that your benefits are not interrupted. And then finally, if you're turning 65 or are currently on Medicare, I have some news for you. The biggest thing is that picking the right Medicare plan can be challenging for a lot of seniors. And on top of that, a lot of Medicare changes are happening that is affecting millions and millions of seniors. This article, for example, talks about 1 million plus seniors that have been dropped by Medicare plans. In the state of Oregon, there's 25% of Advantage plans that are leaving. In Minnesota, 5 health systems with Minnesota operations will say they will go out of network next year with certain Medicare Advantage health insurance. So there's all this activity going on, causing this dramatic headline from the Center for Economic and Policy Research. 34 million seniors in Medicare Advantage plans face rude awakening. What is that about? Well, it's because there are 24,000 plans out there that you have to choose from. And so knowing what plan fits your need in your local area, covering the drugs that you need, the medication that you need, having your doctor in the right network, all that can be challenging. And that is why 90% of all seniors are in the wrong Medicare plan, because picking a plan, the wrong one, can cost you your health, can cost you a lot of money. The average couple spends about $300,000 on Medicare during retirement. So why should you care about all of this? Well, there is help. Our friends at Chapter Medicare can help you sort out through all this confusion and get the Medicare plan you deserve. And their services are free to you. They are free and unbiased with all the access that you need. They are the only Medicare advisory company with access to all 24,000 Medicare plans. They can help you get personalized recommendation that fits your budget, your preferences, your needs, and most importantly, they can save you money up to $1,100 a year. And one of the biggest reasons why we partner with them is that their agents do not work for commission. So when they get on the phone with you, they are not there to sell you the most expensive plan. They're there to help you find the plan that meets your needs. And so, whether you're turning 65 and need to get on Medicare, or are currently on Medicare and trying to switch to a better plan, there may be a small window for you. So, you need to act now. So, call Chapter on the number on the screen, 539 205 2147, or you can go to the comments section in this video or the description of this video, and we'll have a link in there, and there'll be a form you can fill out very quickly, and Chapter will reach out to you and help you avoid being one of the 90% of Medicare recipients that are on the wrong Medicare plan. But you may have a small window to do this, so call them now. They are highly rated, A plus, with a Better Business Bureau, lots of 5-star reviews that you can find online, and they can save you $1,100 on average on Medicare. So if you're turning 65 or currently on Medicare and looking to get on a better plan that better serves you, then call Chapter now. So that's all I have for you today. Thank you for watching this video, and until I see you in the next video, thanks.